In today's video, we are going to be talking about tuberculosis. Once again, welcome to Medsplain, where we talk about complex medical topics in easy-to-understand ways. Tuberculosis, also known as TB, is a disease primarily caused by the bacterium Mycobacterium tuberculosis. However, other bacteria, such as Mycobacterium bovis, can cause TB in some people. TB usually affects the lungs, although it can spread to various parts of the body, like the lymph nodes, brain, kidneys, or spine. It is spread among people by droplets in the air that can remain suspended for several hours before being inhaled. Once the bacteria enter, they're taken up by immune cells in the lung's air sacs and can stay inside the cell, where they can orchestrate the collection of immune cells known as a granuloma. This can be harmful because it supports bacterial growth, leads to lung damage, and enables the spread of infection. TB actually remains inactive in most people, so they're infected with germs but do not experience symptoms and cannot spread the bacteria. In fact, it's estimated that 2 billion people have latent TB globally. However, if the immune system fails to do its job, which can occur due to factors such as old age, AIDS infection, or stressors, TB can become active. TB has 3 primary stages, with differing symptoms in each stage. Signs and symptoms, if present, however, are not specific. During the primary infection, immune cells recognize the bacteria and try to destroy the germs. Although most people do not experience symptoms during this stage, some may have a low fever, tiredness, or cough, similar to the flu. During the latent infection, there are no symptoms because the immune system has constructed a wall of immune cells around the bacteria. During the active infection, the immune system is unable to control the bacteria. Symptoms worsen and include coughing up blood or mucus, chest pains, and difficulty breathing or coughing, fever and chills, night sweats, weight loss, loss of appetite, and lethargy. There are certain risk factors that would make someone susceptible to tuberculosis. These include traveling to places where TB is common, such as Latin America, Africa, Asia, and the Pacific Islands. One's risk of active TB can also be increased by conditions that weaken the immune system, such as HIV/AIDS, diabetes, severe kidney disease, malnutrition, cancer treatment, and smoking. Children under the age of 5 and those 65 and older have a higher risk of having severe symptoms. Treatment of TB varies based on the form being dealt with. Latent TB is treated with a combination of antibiotics called INH plus rifapentine weekly for 3 months to reduce the risk of development into active TB. Active TB is often difficult to treat, requiring lengthy protocols taking anywhere from 3 to 9 months. The initial treatment for TB involves a 4-drug program involving isoniazid, rifampin, pyrazinamide, and ethambutol. Patients with active TB should be isolated from others and actively monitored for the presence of bacteria in sputum and abnormal blood tests. Thank you for learning from Medsplain. We hope that our explanations were concise and easy to understand. If you have any feedback, feel free to comment or contact medsplainbusiness@gmail.com. Remember to like or subscribe to support furthering patient education.